Hi, I'm Elizabeth Hess. I'm here with the administrator of the Champaign-Urbana Public Health District. Hi, Julie Pryde.
Hi, how are you doing?
I'm doing okay, but I know that our district, our area, our state is moving in the wrong direction, at least focus locally. Where are we with the numbers now?
Right now, what we have 538 active cases. Those are persons in isolation. Almost 2,000 are in quarantine. We have 7 hospitalized right now, just Champaign County residents, but our hospitals are definitely filling up with people from the catchment area. And what really is concerning us the most here at CUPHD is that Champaign County, our numbers, our percent positive is now up to 5.6, and it's been steadily, increasing. We like it down around 1% or less, and it's really gone up in October. And we have got to get that turned around, because with all of the testing we do in our county, over a 5% positivity rate is where we would suggest doing mitigation even before the state did. So it's it's something we really all need to take seriously and address, because we're coming in way too hot, as you will, with winter. With winter coming and all the events that are going to be going on, it's a very dangerous time.
It's very confusing because the U of I numbers are at a very low percentage, but what are we seeing? I know that Area 6 is encompassing a lot of counties. Is it more the rural counties now outside of Champaign and Urbana that are spiking the numbers?
They're having very high numbers. I mean, there are some counties around us. Our entire region's positivity rate is about 9.6, which is very high. Some of the counties are up in the 25% range and double digits. That is very scary. So just our county alone without the U of I numbers is at 5.6, which is way too high for us.
We're seeing spikes and record numbers in 31 states across the country. Does that mean we are officially in the second wave of this virus?
Oh, we are absolutely well into the second wave. The problem is, and we've said all along that there are pandemics come in waves. That's how these viral illnesses work when they're new to a population like this. So I keep hearing from people, oh, well, we were told 15 days to, flatten the curve. Okay, this is like an ongoing issue that it seems to not be getting across to some people. The pandemic, until the pandemic is over, we are going to have to continue to mask, stay away from people, especially people who are not in our cohort, and, do a lot of extra hand washing and things like that. Every time we meet with somebody, unmasked or even within, inside without being distanced, every single time we do that, we are risking our health and we're risking their health. So it's something that people really need to consider. This is not, can I get away with this? Yes, of course, people can get away with all kinds of things. It's not about that, because at the end of the day, it's people infecting other people, and it's almost always people infecting people that they know. So you really have got to take this seriously, because we're in a very dangerous time right now with the numbers that we have. And just because you have been doing something and haven't had any infections, the infection rate is way higher right now. So just because you've been doing it and seemingly we're unfazed by it, that doesn't mean that that's going to continue. And yeah, it's my job, but it's also, I feel like, a moral obligation to get people to understand that, because families infect families. People who love each other infect people they love. So it's not just, going out to a store or something like that and you're going to be infected by somebody you don't know. These are person to person. So anytime the mask wearing and the distancing are not maintained, it's a risk.
Health officials have said that if we don't mitigate these numbers, we are going to go back into lockdown, or we're going to have to move back a phase. Does that mean that only grocery stores, hospitals, drugstores will be open? What exactly does a lockdown mean at this phase?
A lockdown would essentially, if that were to happen, it would be what had happened, earlier in March, where basically exactly anybody who can work from home, only go out for emergencies like grocery store. But I can tell people that ideally, I would love to see us doing that now. If you don't have to be out, don't be out. If you don't have to be around other people, don't be. Limit your trips to the grocery store again. I think we got a little complacent because, we were having a pretty good summer and people were able to do stuff outside. We are very much into the dangerous period, and it is not going to end because, just because we're bored with it, it's not going to end. So we have got to really be vigilant with these measures. They do work.
Dr. Fauci has said the next 2 weeks are going to get worse, not better. And then in 3 weeks, we hit Thanksgiving, and then we hit Christmas. And I know people are going to be congregating with families. How do we even get control of the numbers when people aren't taking this small families? Oh, but I know them, they're in my bubble, seriously.
We truthfully, we can't. All the rules and regulations and everything put in place, the fact is this is down to personal behavior. That's what it's down to. It is people protecting themselves and other people. That's what we have. And unfortunately, and we know that there will be these cases where somebody has a family get together at Christmas and then there's a bunch of infections and people die. We see it all the time with, we've seen examples all over the country of this: birthday parties, funerals, weddings, just dinner parties, even if they're little. Every single person that you are having contact with is a risk to yourself, and it's a risk to them because, again, I cannot stress this enough. People are spreading this when they have no idea that they're even sick.
Speaking of that, there was a recent study, 20% of grocery workers at a grocery store in Boston were asymptomatic carriers. 3 out of 4 of those who tested positive had no symptoms. So let's talk about the asymptomatic carrier. You could go to an event or you could interact with somebody and they look perfectly healthy and they feel fine. But isn't this the dangerous case, the dangerous person spreading the virus?
It absolutely is. And even people who get very sick and maybe even be hospitalized later, in the 2 days prior to them getting symptoms, they're infectious. So this is what is really difficult to get people to understand, that it's not like flu where you're sick and you don't go out when you're sick. That's an easy one. That's really an easy one for people to understand. With this, I could be in 2 days from now, I could get sick and be hospitalized from, if I were infected and have absolutely no idea right now.
Let me ask you a question. I'd like you to fact check something. Donald Trump said that doctors are profiting. If they declare somebody gets COVID or dies of COVID, then somehow they get the money. Could you fact check that statement for me, please?
Well, I mean, I'm not a doctor and I'm not working in a healthcare field, at the hospitals or the clinics, but I can assure you that is not the case. And that is very disrespectful and well, ridiculous, honestly. And our healthcare providers are going to be put through the ringer again. They are going to be working their butts off, risking their lives. And, to hear something that ridiculous is just, I don't even know what to say about it, but trust me, we talk to our healthcare providers all the time here. It's going to get bad again. And people need to understand that there are only so many resources out there. You can stand up a field hospital, and we can certainly do that. But eventually, you run out of trained people to do the things that are needed. So we really have got to protect our healthcare system. We're already seeing places where their hospital systems are being overwhelmed. And that's really what we want to avoid, because once you have that, if I'm sitting here and I have an asthma attack and I need to go to the hospital and be hospitalized, there might not be a bed for me. I'm in a wreck or I have a heart attack or any type of thing. You just don't know. You have to protect your healthcare system, or it just compounds everything. Then people can't get treated for other things that they need.
You are the perfect person to explain herd immunity. We've talked about how regular herd immunity is not a good idea. However, let's say we get the vaccine in January and then everyone is vaccinated by April. How does herd immunity take over then in a positive way?
Well, how it works is it would be easier for me to draw this out, but like I said, the virus only goes from person to person. And if you have a person here who is not susceptible, it doesn't go that way, right? So every immune person you have, that works. If the vaccines work, that will be wonderful. Then we can go about it our normal way. Um, to be a proponent of herd immunity through infection with this illness is insane. Number one, conservative estimates say that it could be 2.6 million Americans would die from this virus, and that would be needlessly in order to reach herd immunity. The other thing is we do not know if infection confers immunity. We still don't know that. We know that people are being reinfected. So that indicates that that's probably not a very smart idea to go out and try to get yourself infected. It just isn't. People are parsing words and looking up these really bizarre esoteric questions to ask, and they're looking on the internet for anything that meets their confirmation, bias that they want to say we can do whatever we want. But the reality is you just cannot. And
it is a novel coronavirus. I do that in air quotes because novel means new. We don't know much about it. When the scientists do know about it, they will tell us, right? There is no reason to hide information.
Absolutely. That's why things change during this. It's really hard to remember, especially for those of us who are living it every minute of every day. You have to remind yourself that this virus has only even been known, basically for 10 months, going on 11 months now. It has not been, it's being studied. Everything is, going on behind the scenes, trying to figure out what's going on. And as we get new information from the CDC, we put that information out there, but you have to continue to get your information from trusted science. From trusted sources. And I am very tired of hearing about the Great Barrington Declaration. That thing was put out by a economic think tank. Mm-hmm. Their job was different. Their job was not saving lives. Their job is not anything other than to figure out, economic situation. We're not going to get our economy back to where it needs to be if we kill off, 3 million Americans. That's not the way to go about it at all. We have got to do this like we know we need to do it, like history has told us we need to do it, and that's what we have to do.
For a little bit of good news, a new study shows that immunity to COVID could linger up to 5 months. However, that does not mean that we should jump back into our congregation maskless or that we should invite friends over, right? Because, hey, we've had it, we're cool for 5 months.
No, that is correct. Everyone needs to continue these very basic public health steps throughout the pandemic. And, I have heard, if I had a dime for every time I heard this, I would be retiring somewhere lovely right now. But, that this virus is political and that after November 3rd, it's going to go away. Well, I assure you, when I talk to you next Monday, it will not have gone away. It is not political. There is nothing political about it. There's nothing political about mitigation factors, washing your hands, wearing a mask, any of that stuff. So, we're just, it is, this is how we have to live until we get this pandemic ends. We have to do these measures to protect others and ourselves.
And nobody is more tired of being locked inside and talking about the coronavirus, I'm guessing, than you. Is that probably correct?
Well, I can tell you that public health and healthcare providers in general are, we've been living this every single waking moment since, well, here at CUPHD, since about January. Other places, maybe since March or April, or March at least. But it is, yes, of course, we all want the same thing. We do not want businesses to close. That I don't even know why anybody would think that would be our goal ever. We live in these communities as well. We have friends in this community. We love this community. We want our community to weather this as well as possible. And we know, like I've said since day one, Champaign County will do better than a lot of places because of our collaboration, our coordination. We have a very caring community. We have a very intelligent community. We are not in general a science denying community at all. All of those factors help. It's something that is difficult to replicate every place, but it's something that we are lucky that we have. We have the University of Illinois. We have cooperative government. We have two large healthcare systems. So, but that doesn't mean that we're immune from the problems caused by this. But it just means that we're more likely to follow the guidance better than some places.
I think we're going to end it on that, perfectly stated. I do want to thank Urbana Mayor Diane Marlin, especially hard today, because we talk about Champaign County and the word Champaign, that, you know, people, where are you from? Champaign. Well, I'm from Urbana, and Diane Marlin is doing an excellent job as part of the Twin Cities, just because their name is not on the county. I
Right.
also want to thank Jason Liggett from UPTV, which is a great public access resource. Thank you for everything you do, Jason.
And he's always so flexible.
I know, we text him and say, can we move it up or back? And Jason's like, sure. So thank you, Jason. And Julie, I don't know what my mental health and the mental health of the community would do without you. And I know that you are so understated, but I cannot thank you enough on behalf of everyone. So thank you. Thank you, Julie.
Well, and I can't thank our community enough either, because, you know, all of our mental health is riding on this as well. So we all need to just continue to be supportive of each other through this. It's going to be a difficult winter, and I just want people to understand that. But it will end. So we have to do the hard things as we go along, so that, you know, we can all be here when it ends.
Thank you, Julie Pryde from the Champaign-Urbana Public Health District. Stay safe.
Thank you. You too.